Hi, good evening and welcome to this live stream. My name is Suzanne Lello and I'm a specialist in oral surgery and also practice clinical lead here at Edinburgh Dental Specialists. It is Oral Cancer Awareness Month here in the UK, and this evening I am thrilled to be joined by my colleague Mr Martin Paley, who is a specialist in oral and maxillofacial surgery, Dr Catherine Tannahill, who is our Director of Dentistry at Portman-Dentex, and Dr Ben Atkins, a long-standing trustee and past president of the Oral Health Foundation. Thank you all so much for joining us this evening. We are going to be talking about oral cancer and the role the general dental practitioner plays in helping our patients navigate their way through this disease, from screening of patients all the way through to post-operative monitoring of patients in general practice. Please do ask us questions as we go along using the chat box, and we will endeavour to answer these to the best of our ability. As always, if we don't know the answer to a question, we will come back to you at a later date. Also, a reminder that this is a live stream, however, it is being recorded, and you will be able to access that recording later on the Portman-Dentex YouTube or LinkedIn channels. So that being said, let's kick off. Martin, can you tell us a little bit about the current incidence of oral cancers? And has this changed at all over the last few decades?
Thanks, Sue. So, statistics, you want to start with statistics?
I do. I love a stat.
So, a quick look on CRUK website last night. Here's a few facts and figures for you then.
Okay.
So, head and neck cancer. So, we're not just talking about mouth cancer, but cancer of the head and neck. So, mouth cancer, oropharynx cancer, and larynx cancer accounted for 12,400 cases in the UK last year. Of that, there were 4,000 deaths. The survival figures for the last sort of cohort that was done a number of years ago for 10-year survival range between 19 and 59%. Okay. Some of the interesting stats about preventable cases. How many of these cancers were preventable? They reckon that between 46 and 88% of those cases might have been preventable.
And is that through lifestyle choice?
Through lifestyle choice. So, unfortunately, yeah, smoking and alcohol.
Okay.
And head and neck cancer is the 8th most common cancer in the UK. In men, it's the 4th most common, and in women, it's the 13th. Enough facts and figures?
Yeah, that'll do.
One interesting fact that we are seeing, though, sadly, is that cancer in the mouth and head and neck cancer in general, the numbers are increasing and have been doing for many, many years now. Okay. I've been working here in Edinburgh since 2005, and at that time, our head and neck cancer MDT had to deal with about 240 cases of head and neck cancer a year. So, and then 10 years later, that number had risen to 350 cases a year. So, unfortunately, we are seeing a year-on-year increase in the number of cases of head and neck cancer.
And is that equal across men and women?
No, so there does seem to be, unfortunately, a bigger increase in women than men. The ratio of male to female used to be 5 men to 1 woman, and it's now near 2 to 1. So that has definitely changed. Unfortunately, we're seeing more cancer in women.
And what do you think is driving that? That's an interesting change.
Again, I think that mainly relates to lifestyle choices. So an increase in alcohol use. Smoking has actually decreased. The use of tobacco has significantly decreased over the years, but alcohol use has done the reverse, unfortunately. Okay. And the other factor that's probably playing into this now is HPV as well.
Yeah, so interesting you mentioned HPV. So, I mean, can a dentist, can we tell any difference from a cancer that it is HPV related just by looking at it? Do they present in a particular way that we should be aware of?
So HPV is quite specific in terms of mouth cancer, cancer of your tongue, say, floor of mouth, your buccal mucosa. Only a very small number of those are HPV positive, about 1%. But in your oropharynx, so your tonsil, your tongue base, and your soft palate, then near 70 to 80% of those cancers are HPV driven. So oropharyngeal cancer is definitely an HPV related disease. So if you see cancer in the oropharynx, it's more likely to be HPV driven. They often present as maybe a small primary tumor, sometimes an undiagnosed primary tumor, one that we can't see. It doesn't show up on clinical examinations, doesn't show on scans, but they often present with large neck nodes. Not always, but sometimes that's the case.
Okay, so important then when dentists are screening patients, as they will do in practice, that they do have a good look into the oropharynx. It's maybe an area that's kind of easy to miss on a busy day, but important when you're examining a patient and doing your checkup to have a look into the oropharynx.
Absolutely. I mean, it's really part of your examination. It should be that you examine the tongues, floor of mouth, the cheeks, all the areas of the mouth, but also the back of the oropharynx. So look at the soft palate, look at the tonsils, and get them to really move their tongue around so you can see all the areas of the back of the tongue as best you can.
Yeah. Okay. And when I was training as well, it kind of oral cancer seemed to be a disease of your kind of 60-year-old male smoker, and obviously that seems to now be changing. Do you see oral cancers, I mean, in the full range of ages? I mean, can you get oral cancer in children, for example, or in the elderly?
And again, absolutely right. So yeah, when I first started as a consultant, your typical patient was a male smoker, drinker, 60s, who got cancer on his tongue, and that was the commonest presentation. We're seeing a much higher number of older patients, probably because patients are living longer. People are living longer. And as we age, our cells don't work as well as they used to do, DNA repair and damage. So we're seeing definitely an increase in number of older patients with mouth cancer. And some of them, unfortunately, field change, so it's not just one cancer. Sometimes they can have multiple sites or multiple cancers as they go through their treatment and their follow-up.
Yeah, so what's the most unusual presentation of a cancer you've seen then? We were chatting about this earlier, it's quite interesting.
Unusual? So multiple cancers. Yeah. I've had one patient who presented with 7 different cancers in their mouth all at the same time.
Wow.
Who was able to have treatment, surgical treatment and radiotherapy, and has done one. But yeah, it's not unusual to have more than one. That was a very unusual case.
Yeah, that is unusual.
The other unusual and distressing thing, I guess, is children. So sometimes we do see cancers in smaller children, even as young as 12 or 13, and yeah, it's not something that you think of, but
no, they haven't really lived long enough to have the lifestyle impact, have they? So,
but that's another fact, is that about a quarter of patients that we see have absolutely no risk factors whatsoever. So they don't smoke, they don't drink, they don't have a premaligne condition or a lesion, and they have, why have I got this cancer? And in those patients, there isn't a reason why. So yeah,
that's hard to remember. Yeah, absolutely. So I suppose it's just really important to remember that it doesn't matter what the age of the patient is.
No.
If there's something there that you can't explain, or that's suspicious, or something that's not healing as you would expect, then the referral pathway is there, and that's what it's there for.
Absolutely, yeah, yeah. So
referring through the NHS on the 2-week wait, can you give us some examples then of the sorts of things general practitioners should be referring on an urgent basis to the hospital?
Yeah, so any system will have its referral help guidelines, and then we have this thing called RefHelp, and on that it usually gives you a very clear idea of what patients that you should refer on the urgent suspicion of cancer pathways, we call it in Scotland. But things like a mouth ulcer that doesn't heal after 3 to 4 weeks, things like a lump in the neck, things like loose teeth when it's not periodontal disease, so teeth
Yeah.
that are mobile for no
Unexplained
apparent reason.
mobility. Yeah.
Yeah.
Okay.
Red patches, specifically red patches or red and white mixed patches. White patches have got a far lower risk of being cancer. Only about 2% of those will change to cancer. But red patches have a much higher risk of malignant transformation or indeed being dysplasia. So a red and white mixed patch definitely is an urgent referral.
Okay. And when a general practitioner then comes across a patient and they're suspicious of oral cancer, and they want to refer them on the 2-week wait, is there anything, well, firstly, I suppose, how do they, or can you give us any tips or examples about how to manage that conversation initially with the patient about why they're going to be referring and what to expect?
So I guess it starts with you've done an examination, you've seen something you're not happy about, and I guess that probably can just be the basis to your conversation. So I see you for your follow-ups, your checkups every 6 months, whatever. And today I've noticed that you've got this ulcer on your tongue, say that's you said it's been there for 3 or 4 weeks, or longer, and I'm not sure what it is, but it shouldn't be there. That's not normal. You've not had that before, so I'm a bit unhappy about that. You can use words like that, unhappy or suspicious, I suppose. I mean, it's best to be honest with your patients because otherwise they don't know your concern. They maybe don't know why you're referring them, and therefore they maybe wouldn't turn up for that appointment. So it's important to have that honest conversation with your patient as to why you're doing it, and explain your concern about it, and that normally in most patients would mean, okay, fine, let's go and get it checked. That's great. Okay.
And so when they come for that first appointment with you at the hospital, is there anything as a general practitioner that you can do to prepare the patient for what to expect on that first visit to the hospital?
Okay, so the use of early suspicion cancer pathway is designed to try and get people seen as quickly as possible and diagnosed and then into treatment. So the aim is that if you refer somebody on that pathway, they should get an appointment within 2 weeks.
Okay.
And we try wherever possible that if we see somebody who has got a suspicious lesion that we're unhappy with, that they get a biopsy, usually on that first appointment.
Okay, so that's definitely worth mentioning to the patient.
Yeah, so absolutely. So you might, we'll send you for this problem, and they might decide to do a biopsy, they might decide to do other tests, they might decide to do blood tests or X-rays, and they might arrange scans for you. And I guess if you're very concerned that this looks like cancer, then it would be useful if they had somebody with them to support them, because that conversation will be, well, I see enough cancer in my day job that you might as well broach that thing right from the very beginning. So, do you have any questions? What do you think this is? And then that conversation goes on from there.
Yeah, and I guess that's just emotional support, isn't it? And another pair of ears for the patient.
Somebody with you,
because sometimes it can really take them back, can't it?
Yeah.
Okay, great. We did talk earlier about kind of the patient journey. So once they come into the hospital and what they then experience, and you mentioned to me that there was a documentary you would recommend people watch.
Oh yeah.
Can you tell us a bit more about that?
Yeah. So as part of Stand Up to Cancer that's recently been on the TV, and I don't know, some of you may have seen it, but Rod Gilbert, the comedian, unfortunately was diagnosed with oropharyngeal cancer and had to have chemoradiotherapy treatment for that. And he said a video diary of his journey, and it is an amazing program to watch, and very moving, very difficult, but for anybody that works in the business, you completely understand where he's coming from and how it's affected him.
Is it something you would recommend patients to watch, or would that be too confronting when someone's at the beginning of that journey to be faced with that sort of honest diary?
I think we all try to make sure our patients understand what's coming, and it does that. It allows you to understand what's coming. So yeah, I think it would be a very good thing for patients
to watch.
And certainly a very good thing for health professionals to watch, so they can understand what their patient may be going through if they're in that situation.
Okay.
So yeah, you can get it on, I think, so Channel 4. So
Channel 4. So Channel 4, you can watch of that. And then, so the patient kind of, from the general practitioner's point of view, they pick something up, and if the patient is diagnosed with cancer, obviously they go through this journey, as we've talked about with you and your team, your colleagues in the hospital. And then hopefully the next time they see the general practitioner, they're on the other side, so they maybe had some chemoradiotherapy, some surgery. So what should general practitioners bear in mind when these patients hopefully come back to practice? And I mean, obviously you will follow them up in the hospital for 5 years usually, and then they'll be discharged. I mean, what are the chances of them having a recurrence? Are there any statistics around that, and what sort of things should general practitioners be thinking about with these patients?
So as you say, they will be in the system and followed up for 5 years after the treatment, so they'll be getting all the support and the follow-up from the point of view of cancer treatment. They may be getting some dental rehabilitation as part of that treatment, so they might be needing implants, say, and prosthetic work in order to get them back to functioning as well as possible. They may have had radiotherapy, so they may well have a drier mouth, they will have an increased caries risk. They need regular checkups. They should have a lot of that covered with information about fluoride and regular therapy and care and so on. But their general dental practitioner it is still important that they keep up with their general dental practitioner for regular checkups and regular maintenance as required. And the other factor there is that, at the end of that 5 years, they hopefully should be discharged. And then again, somebody needs to keep an eye on them. If they've seen their regular dentist regularly, then that can be done, because we know from statistics that unfortunately about a quarter of patients who survive their cancer will get another head and neck cancer.
So another primary, not related to the...
So not a recurrence, but another primary.
Primary.
It is not uncommon, unfortunately, for patients to get more than one cancer.
Okay. So oral screening is still as important
Indeed.
as if they've never had an oral cancer. Okay, great. Well, thanks, Martin, for that information. I'd like to invite Catherine and Ben into the discussion now. We're going to talk a little bit just about educating patients and what we can do to educate patients on the risks, and also hear from Ben. Thanks very much for waiting patiently, you two. So hear from Ben a little bit about the Oral Health Foundation. So if I start with you, Catherine, can you just give us an idea of what we can do to help educate our patients about oral cancer?
Yeah, I loved what you were saying earlier on. It was really interesting hearing Martin and yourself talking about honesty, being honest with your patients. And I think one of the big things that we can all do as clinicians is to make sure that we're completely honest with our patients when we're doing an examination. So that means educating them on what we're doing when we're doing it. So if we are checking the lymph nodes, are we telling them that that's what we're doing and why we're doing it? I'm a big believer on being very clear with patients about the mouth cancer check, what you're looking at, what you're looking for, and making sure that they're aware that that's what you're doing. I would like to think that our patients all know that that's what we're doing when we're doing it, because it opens up the conversation. Then you can have that honest conversation about the risks of mouth cancer and the concerns, and then patients are aware that that's a big part of our role as healthcare professionals. And in the dental practice setting and a general practice, that might be a dentist, it might equally be a hygienist or a therapist or a nurse who's spotted something that they're concerned about. And I think we all have a role to play in that. And in terms of educating patients on the risks, of course, there's conversation about alcohol consumption, those lifestyle choices, smoking, for example, and making sure that we're checking in with them to make sure that they understand those risks completely in a non-judgmental way, of course. And then the other part of it is the HPV-related cancers, of course, talking to parents about the HPV vaccine and making sure that our younger patients are taking the opportunity to have that vaccine, because we know that it's very effective. And it's good to catch that 12 to 15-year-old age group, because, of course, those children are eligible for the vaccine, both boys and girls now, and why not take that up? So for me, it's a whole team effort, that's for sure.
Yeah, absolutely. I totally agree with you, actually. And it's something I've only relatively recently started doing in my practice, is really explaining to patients why I'm feeling the neck and what I'm feeling for and why it's so important that's done. So yeah, I couldn't agree more with what you said there, Catherine. Ben, can you just come in and just tell us a little bit about the Oral Health Foundation and your role in sort of supporting clinicians and what clinicians can do as well to support the Oral Health Foundation?
Thank you, Susie. Yes, I'm the past president of the Oral Health Foundation, and we're there to promote dental health, really. So we have many campaigns, from National Smile Month to our Safe Smile campaign and Mouth Cancer Action Month. So one of the key roles I often find with the Oral Health Foundation is to give those tools for practitioners to talk to their patients in simple language that's not dental jargon, like what we talk. So if you need any further information, you can look at dentalhealth.org/mouth cancer, and there's loads of information on there and tools you can use with your patients, especially the preventative messages. And dentists can really help with HPV campaigns with their patients, talking about what the support is. So the main thing is having the message, if in doubt, get it checked out, because there's no such thing as stupid questions. If you catch things really early, it makes such a difference to our patients.
Yeah, absolutely. Yeah, I mean, it really does. And I think we've all seen probably patients where we have managed to catch it early, and they are obviously more likely to have successful outcomes.
So yeah, I mean, catching early is crucial, because absolutely, your stage 1 cancer, your survival is 90%.
Yeah.
Stage 4, you're down to 25-30%. So it makes a big difference as to your likelihood of survival.
Outcomes. And so, yeah, that's great. I mean, the Oral Health Foundation, then, so we can go to that website, and presumably there are lots of downloadable information leaflets, you say, and posters and things that dentists can use to help educate patients. Is there anything more that dentists can do to support the foundation? You know, is there anything specific?
You can do the fundraising, that sort of thing, but for me, it's that simple spreading the messages is enough for the foundation. And it's that key message that Catherine, you guys said before, is letting patients know what you're doing when you're checking for mouth cancer, checking for lumps or bumps that patients are often not really aware we're doing. And actually, for me, those checks are probably the most important thing we do. And we don't tell patients we're doing it. So those really simple messages can make such an increase in understanding for patients, because they know you're watching as well as them. So there are there's lots of other signposts that we have with the Swallows Head and Neck Cancer Support Charity. There's the Mouth Cancer Foundation. You know, there's lots of different areas for patients to get different advice from. So for me as a clinician, my role was actually as a conductor. It's not just you sent a patient off to you guys in, the hospitals and stuff. It's actually, have you phoned that patient up afterwards? Have you made sure they're okay? Have they got any questions? You're still there as their clinician, because you're going to have to do the prevention when they come back. So what you can do, prepare as a clinician, is what happens if you find that cancer. Do you know what to do? Have you spoke to your local Max Fax department saying, look, am I doing the right thing? There's no reason you can't get really prepared for that. Do you know which saliva substitutes you can use in your practice? Do you know how to prescribe them? Have you speak to their GP? And as an associate, as a dentist, it's really important to be prepared for when you find cancer. You will find it in your career. We've all had that horrible feeling when we can't diagnose in general practice, but deep down when you're sending someone in, when you want them seen yesterday, and you need to know as a clinician that you have done your level best for that patient, because then you can support them and their families to create information. So if you visit dentalhealth.org, there's loads of information there about almost the journey mapped out, and the information you need to have at that press button, so you can look after the patient, not think, oh, what am I doing on referrals?
Yeah, and actually make a really important point there, because obviously as a general practitioner, you have really usually long-standing relationships with your patients, and actually you're going to be a major source of support for them during what is a very scary time for them and their families. So you make actually a really important point. I think being in the sort of on the other side of the hospital system, we can often focus very much on what's happening there and not really be thinking too much about what's happening at at home for the patient, and actually general practitioner then becomes a really major source of support for them.
You guys are just borrowing our patient for a little bit, and we want them back. And it's really important that patient feels valued and part of the journey. And it's normal to come back to the practitioner because they go through a journey. They go through a journey that I never want to touch in my life. But I've got to be there to make sure we can support them. And that preventative message, it's complicated enough, mouth cancer, without a lot of dental decay and disease afterwards.
Yeah, absolutely. Absolutely. Great. I don't think we've had any questions. I can't see any questions that are coming through. Does anyone here on the chat have anything else that they want to add to this conversation? No, we've all covered all the important parts. Well, I mean, I just want to say a big thank you to you, Catherine, Martin and Ben, for joining us this evening on this live stream about oral cancer. If anyone does think of any questions, then please do send them to us and we will come back to you. Oh, the name of the documentary, it was about Rod Gilbert. I don't know.
Yes, it's on Channel 4. It was just a month or so ago. It's part of the Stand Up to Cancer series, and you'll be able to catch it on
the 4 on demand, is it?
4 on demand.
4 on demand.
It was Rod Gilbert.
Rod Gilbert, the comedian. So that sounds like it's really worth a watch for both dentists and patients.
Yeah, it's a difficult watch, but it's a very important one, I think, and it definitely gives you an idea of what these patients have to go through on their journey.
Great, thank you.
But yeah, the more we can educate our patients, the more we can pick up cancers early, then hopefully the lesser is the morbidity of their treatment, and the better is their survival. So this whole educating dentists, but also educating patients, is really, really important.
Yeah, it is. I suppose it empowers the patient, doesn't it, not to ignore something, or to act quickly, whether if they notice something.
It is a regular comment from patients. I'm so glad my dentist mentioned that and picked up on that and got me sent in, because I hadn't noticed it, or I noticed it and managed to get an appointment, managed to get it checked, and here I am. So
great. Okay. Great. Well, I mean, thank you so much again, everyone, for joining us, for giving up your evening. Thank you, Catherine and Ben. Thank you, Martin. Just a reminder, this is live, but the recording will go on the Portman-Dentex YouTube channel or the LinkedIn channel later on, so you can access this later if you want to revisit it. So yes, thank you very much, and have a very enjoyable evening wherever you are. Oh, there has been a last minute question there. Is there an age limit to a patient having the HPV vaccine? I think it's around 13 they have the vaccine, is that right?
So vaccination, as far as I understand, is through the NHS system anyway, is for young children, boys and girls. But I do know of people who have done it privately for their children prior to this and who are older. But the idea is to get the vaccine before you have much exposure to the HPV virus.
Yeah, because most people will be exposed to HPV, won't they, during their lifetime?
I believe it's available up until the age of 25 under the NHS. I think that's right. You can have it beyond that, but it's most effective if you have it before you're sexually active, which is why we try and capture people at that kind of 12 to 15 age group.
Great. So assuming there are no other questions, just like to say thank you again and enjoy the rest of your evening, everybody. Thank you.
Thank you, Martin and Susie and Ben. Thank you.